leadership can help you understand yourself and your team. There are some interactive pieces to this. I will sort of ask people to come off mute and give me your thoughts and your discussions. I don't want to just talk at you for 3 hours, for an hour. I'd love to, hear from all of you. I do have a couple of disclosures. I am part of the government, but none of this is part of the government. I don't have anything to disclose. And this talk was made in conjunction with Dr. Jessica Serby. So I want you to start with sort of imagining yourself in this situation. So you're junior faculty, you're a year out of fellowship, and you get called to a complicated delivery. One of the faculty who has been there for about 10 years is the faculty with you. This faculty trained you and is highly revered in the department and is well liked by everyone. You're prepping for umbilical lines, and you see the faculty member is struggling with the airway. You offer to provide assistance, and the faculty member says loudly, "I've got this, I don't need your help." So just kind of imagine in your head, put yourself in that scenario. We're going to come back to this a few times as we move through this talk and think about how this plays into both leadership and followership. So the first thing we have to do is talk about what leadership and followership is. And by doing that, we really need to think about what are the characteristics that go into both leadership and followership. And then we need to discuss how this relates to healthcare professionals. Part of this process is really reflecting on your own leadership and followership styles and how that might impact you in your work. And by the end of this, I hope that you have the ability to develop a personal action plan for your own leadership and followership. So let's start with a question just to kind of get people loosened up and out there talking. What is leadership and what is followership? So feel free to come off mute and sort of give me what your thoughts are, or if you're comfortable, you can also put it in the chat. What is leadership? What is followership?
I think leadership is working as the head of a team or working alongside individuals to try to make either individuals better or make a kind of collective process better. And followership is being comfortable in the role as a member of the team to not only take direction and take constructive criticism from leaders, but also provide constructive criticism to all the rest of the members of your team.
Well, excellent. That's such a great encompassation of the things that I'm going to talk about today. Really thinking about leadership from a standpoint of, leading the team and followership as part of the team, but an important active part of the team. So thank you for that. Other thoughts, feel free to type in the chat or just kind of come off mute and tell me what you think. When you think of leadership or followership, what do you think of? Feel free to just type in the chat or come off mute. Any of the above. Let's see here. So, I see. Somebody sent a direct message, which is totally fine. So leadership is modeling, including humility, directing, supporting, and building the team to best performance and success. And that's a really nice summary of the really important skills that are involved in leadership. Absolutely. So let's get at least one more discussion or definition of followership. Ah, I see. You can only send me direct messages. Well, that's good to know. Well, if you send them to me, I'll be happy to read them out loud. All right, so leadership, providing oversight, big picture guidance, and followership is adherence to a plan, which is absolutely a part of followership for sure. So let's spend a little time really digging into these definitions to make sure that we're all on the same sheet of music. So followership is a skill that is practiced by individuals who have responsibility but don't necessarily have authority. So gives people opportunities to exert their influence. And the biggest piece of this is executing the vision of the leader or the vision of the team. And so I really want to highlight the idea that their followership requires responsibility and it requires active engagement. Leadership often has the authority piece, whereas followership has a lot of the same responsibilities without the authority. But at the end of the day, we're helping to execute the vision of the leader. All right, so let's go back to our case. Remember, you should now be able to chat with everyone. Excellent. So remember, you're a junior faculty. When you're at a fellowship, you're going to a complicated delivery with a revered faculty who's been there for 10 years. You're prepping the umbilical lines and the faculty member that trained you is struggling with the airway. You offer to provide assistance and they say, I've got this loudly. So we are going to try a poll. So everyone get out their phones and use this QR code. I'll give you a few minutes or just a minute to use your phone, do this QR code, or you can text 22333 and just text G Haischer-Rollo 402 and that should get you in. And I'll give you just a minute to get into the poll. All right. So I'm going to go ahead and move to the poll itself. There should still be a QR code in the corner to help you get in. So I want you to consider what you would do in that case. It looks like some people are already answering. Great. So what would you do? Would you stand by and hold cricoid pressure? Would you say, I'm concerned, we don't have an airway, I have a fresh tube, let me try? Would you say, if you haven't gotten the airway yet, you won't get it, it's someone else's turn, move out of the way and do that little hip check? Or would you ask quietly if they need anything, glide sculpt, shoulder roll to help them be successful? So it's interesting as, we see not a lot of people are going to stand by and just hold cricoid pressure, and not a lot of people are doing the hip check. We have a large number of our group who would just ask quietly if they need anything, help them be successful, and about 20% saying they're concerned we don't have an airway. And so when we continue on through this talk, I just want you to think about which style of followership you might be feeling like you're is similar to. And we're going to come back to this again. So let's talk about followership styles. So to orient you here, this slide, on the y-axis, it's a level of support. How supportive are you as a follower? And across the x-axis is going to be how willing you are to challenge the leader. So let's go through each one of these and talk about what this looks like. So the first quarter that we're going to talk about is the implementer. So the implementer has a high level of support, but a low level of willingness to challenge. So somebody who's an implementer is going to be a hard worker, a conscientious worker, somebody who's really supporting change in the group, but they're much less likely to resist something they disagree with. So they're less likely to challenge, even if they see the leader sort of veering off course or not quite moving in the right direction. An implementer is less willing to challenge. A partner is a high support, high challenge. And so when I say challenge, that doesn't necessarily mean butting heads, but somebody who's going to understand what the vision is and come together to support the leader, but also when the leader's veering off course, challenge them and help them course correct. And part of that means offering solutions. So we've all sort of worked with people or followers who have a lot of complaints or can see a lot of problems, but don't often come with solutions. And so a partner is somebody who's going to support change, but also offer solutions within that. A resource is somebody who's going to be low support and low challenge. So this is somebody who doesn't offer solutions, doesn't really like change, isn't going to stand in the way. This is the kind of person who's going to do their work, but no more. And they're not going to be super duper helpful, but they are going to come in and get the job done. And then we have an individualist. So individualists are low support, high challenge. And I think as we talk through this, we've all worked with people who don't like change. They're super resistant, very vocal to things they don't like, and often don't show respect to hierarchy. And so they're willing to sort of speak up and point out complaints, but don't offer a lot of help or solutions. So now that we've talked a little bit about these different followership styles, let's go back to your answers. So standing by and holding cricoid pressure, that's going to be a resource. So that person is going to be they're low challenge, low support. They're not really doing very much to help. They're helping by handing cricoid pressure, not really like moving forward. So nobody in this group chose that one. Saying, I'm concerned that we don't have an airway. I have a fresh tube, let me try. This is a partner. So this is somebody that is recognizing that there may not be the leader in the group, but the goal of the resuscitation is to secure an airway. So let me partner with you. Let me give it a shot. We're going to work together in this. I'm going to sort of here's a solution, essentially. The individualist is going to be the one that hip checks, and there was nobody in this group. The vast majority of the group were in the implementer. And this is super, super common in the medical field. A lot of people are implementers. So these are people that are low challenge, high support. So quietly asking if they need anything. They're still trying to help the person be successful. They're offering some solutions, but they're not challenging the leader, even though they know things aren't moving in the right direction. And this is the most common type of follower that we see in the medical field. So now that we understand what effective or what followership looks like, we're going to compare and contrast a little bit how this works with effective leaders. So an effective leader, I think we can all agree based on sort of the chat things that you were putting in, an effective leader is somebody who creates a vision for the team and can communicate that in a way that the team can understand and get behind. And that means the leader is going to have to be accountable to their own actions and the action of the team, as well as display things like integrity. So they need to be showing people that they will continue on with whatever action they said they would do and do it in the same way every time. This requires a lot of emotional intelligence to be able to do all of these things. And a really effective leader is somebody who can catalyze change in a way that empowers the followers to be able to use the vision in their communication to be able to move things forward. So what then do you think might be some characteristics of effective followers? And feel free again to just come off mute and shout them out or put them in the chat. What are some characteristics of an effective follower?
Someone who's supportive.
Okay, supportive, absolutely. And we saw that in the implementer role and in the partner role, being supportive and not being abrasive. Great. Other characteristics of effective followers that you can think of? I'm a big fan of the awkward pause to let people have time to think. Okay, offer solutions. Excellent. Somebody who anticipates the team's needs. I think both of those are incredibly important parts of effective followership. Accepting responsibility. You're absolutely right. Accepting responsibility for themselves and for the team. And they do, you're right. They have a responsibility to maintain the goal and the mission of the entire team. So I think you're hitting right on with when we're talking about characteristics of effective followers. Let's look at a couple other ones that come from the literature. So an effective follower is somebody who's truly like engaged in the process. You could see that the people that are more of a resource tend to be a little bit less active. They're a little bit less proactive, and so they may be a little less engaged in what's happening. An effective follower needs to be able to think critically, and this means being able to not only think critically, but figure out how to communicate what they're thinking and what they're proposing with solutions in a way that still respects the fact that it's a team and that there is a leader of the team, and is able to strike that balance between hip checking someone out of the way and being able to provide a little bit of pushback when pushback is necessary. And that really comes with that proposing solutions. An effective follower also has to have courage. It can be really challenging. And I specifically chose the scenario that I did in somebody that, was 10 years older, that had trained this person, that was very well respected. It can be really hard to speak up when we're a follower in a situation that we're working with somebody who outranks us. In the military, rank definitely is something we think about, but within the academic hierarchy too, that can be really challenging. And doesn't matter where you are, what level you are, whether you're a fellow, whether you're an attending, a program director, there's always somebody that potentially outranks us. And if we're thinking about developing effective followers, being able to create an environment where people can speak up helps them develop that skill. You also have to be able to advocate. And I think this is what we were talking about when you said offering solutions and kind of maintaining the goal and the mission. That's really advocating. And again, it's incumbent on the leader to make sure that the vision is clear for the group, so that the group knows what to advocate for. There also needs to be a lot of initiative within followers. And I think as I'm like building this picture in your minds, I know I can definitely think of followers that I've had that really embody all these characteristics. And so it's helpful to sort of like think about somebody who that you would consider an effective follower, and think about how did they get the job done? How did they speak up? How are they engaged? And that really helps then build a model for what effective followership looks like. The last part of it is part of the speaking up is being able to provide constructive criticism to colleagues and to superiors. And again, that takes a lot of courage. That's not something that's super easy to do, but it certainly is easier to do in learning climates and learning environments where we encourage everyone to speak up in these moments. And then the last piece is exactly what you were talking about with accepting responsibility. Part of that too is acknowledging the work of others, recognizing that as a team, acknowledging the work of others is really important to continue to move the team forward. So now that we've talked about leadership and we talked about followership, let's put them side by side and sort of compare what the two look like. So we kind of talked about leaders need vision and accountability and emotional intelligence, and followers need to have a good role. They need good team communication. They need to be able to think and propose solutions. And then there are a couple of characteristics that are important for both leaders and followers. And that's why I think it's important to consider what this might look like in your programs. So leaders and followers both need empathy for the team, and they all have to be authentic. Authenticity is incredibly important in a both leadership and followership manner. Being able to delegate and communicate, and exactly what you all said about the ownership and taking ownership for the team, that overall is important for both leaders and followers. But one extra thing that I added onto here that I think is really important is that a really effective leader also displays effective followership. And so think about, kind of think back to the person that in your head who displayed effective followership. Now imagine them in a leadership position. The people that are the most effective followers that really embrace followership become the most effective leaders because they understand where the roles are different and where they overlap and what skills are necessary. So I'm building all of this up for all of you to start thinking about your own followership styles. But up until now, I've really just been talking about leadership and followership sort of in a generic fashion. And so I want to bring it into medicine. Clinical medicine in general, we're a team sport. We all have team dynamics, whether you're in a clinic, whether you're in the hospital, in the ICU, no matter where we are, we work in teams. And when we have good leadership and good followership, what follows beyond that, if you think about all those skills, is really good communication and respect among everybody on the team. And ultimately what this does, and it's what's been shown to do, is maximize patient safety and the quality of care. And we start to see things like this with things like team steps, where it, offers opportunities for everyone on the team to speak up and things like that. Those types of models are all based on followership in medicine. The other thing is that 80% of our workforce falls in the followership role. I'll just say that again. 80% of our workforce falls into the followership role, which means that we spend a heck of a lot of time talking about leadership and leadership skills for 20% of people, but we don't often talk about followership and developing followership skills, despite the fact that 80% of us fall into a followership role. So something that really struck me as I was putting this talk together. So now let's move into how does this go with medical education. Trainees in general are more likely to fall into the implementer role. And I don't think that's terribly surprising given what hierarchy we create in medicine. Now, over the last 5 to 10 years, this is making a slow change forward as we sort of introduce this idea of learning climate, but still traditional hierarchy means that people are less willing to speak up and they're less willing to challenge. And this is particularly important when we think about communication failures as a factor in over 75% of RCAs. And in many of these cases, it was trainees not speaking up because of fear of the reputation, fear of not being told that they're wrong, trying to avoid conflict. So you can imagine, I know myself when I was a trainee, I definitely 100% was in the implementer role. It's like, these people, they know what they're doing. They know what they're, I'm just going to follow along and hope for the best. And it wasn't until years later that I started to understand how important followership can be in recognizing how I could actually help the team move forward. And so I want you to think back to those traits of an effective follower. And if you can't remember, I put them in the little box in the corner just to jog everyone's memory. And I want you to think about how you might be able to implement the idea of followership more in your program. And to do this, it really is a lot about labeling it. If you look through this, there's a lot of traits here of effective followers that our followers are already doing, but they don't know they're doing it because we haven't labeled it that. So first step is just recognizing what followership is, what good followership looks like, and then labeling it for people. Hey, you took really great ownership for the team, and the team messed up and you really stood up and took ownership for the team. I know I'm the team leader, but as the fellow, that was really good followership. And at first, it kind of, when I first started talking about this, people were like, yeah, but that kind of sounds like you're talking down to somebody because you're calling them a follower, and we really need to talk about leadership. And so that's why I prefaced all of this by saying that followership is a leadership skill, because again, it's all about the team and recognizing that followership is important and that most of us fall into these roles. So the next piece of this then is giving feedback on these traits. Part of medical education is pointing out when people are doing things well and pointing out where maybe things aren't going so well. And so how can we help our followers be more effective? By giving them feedback on those specific traits, which means you have to remember what those specific traits are. And then another really, really important part of effective followership is being a good role model for effective followership. And that means, again, saying out loud, hey, I was a follower at this meet, I was at this meeting and this is what happened and this is when I spoke up. I was really practicing my followership. So by labeling it and then role modeling it, we can help other people, learners in our environment, other followers understand what it is and how to harness it. Now, lest you think I just made all of this up, I did find a study that was looking at participants in an ICU setting. And this is where burnout comes in. So I know everyone was wondering, how is this going to connect to burnout? So they looked at 64 participants in an ICU setting, and they were residents and nurses. And they gave them a whole battery of tests. And some of them were, there's the Kelly scale for followership. They gave them burnout scoring, job satisfaction scoring, a whole battery of tests. And then they did a lot of interviews and discussions and a lot of like cross-referencing. And what they found was of the 64 participants, more than 70% of them were in the partner followership style, which that's surprising because more people tend to be in the implementer or in the resource than in the partner. But in this particular ICU, there were more partners. What they also found was that active engagement, if you remember, you think back to the partner styles, active engagement and critical thinking were very closely related to increased job satisfaction and decreased burnout. So people who have felt like they had active engagement and critical thinking, therefore were high on the partnership scale, when they were paired with a leader who encouraged their active engagement and critical thinking, had decreased burnout. So if the leader of the group encourages the followers in the group to be partners, everybody in the team will have decreased burnout because people will have more personal satisfaction and more enjoyment in what they're doing because they're allowed that active engagement and critical thinking. So if we're able to, as leaders, recognize our leadership style, help our followers find that partnership style, and help them engage in grooming the traits for effective followership, we can then decrease burnout overall in our ICUs. I know it's pretty great, isn't it? I was pretty excited when I read this. All right, we are exactly halfway through and we have exactly 30 minutes left. So I'm staying right on track here. All right, so we've talked about leadership and followership. We've talked about those characteristics and how they relate to healthcare professionals. Now we're going to reflect on our own leadership and followership styles and think about then a plan for moving forward. All right, so the first part of this is self-reflection, really thinking about and being honest with yourself and committing to your followership role. And it doesn't matter, again, if you're a program director, if you're a fellow, where you are in your training, everyone has a followership style. Everyone's going to be follower at some point. And so committing to your own followership role helps you and improves your perspective when you are a leader. And this means that we have to be intentional when we're thinking about ourselves in the followership role. We have to be intentional when we get into the followership role. We have to be intentional about what's happening in that space. And so part of it is just recognition. Coming here today, listening to these definitions, you'll be more aware of it. And then the next part of it involves some courage. And it's courage to have moral action, and it's courage to speak up. And so really thinking about how much courage will it take in your clinical learning environment or in your committees, how much courage does it take to speak up, to speak to hierarchy, and to do it in a way that will continue moving things forward. So I'm going to give you all some time to self-reflect. So what I want you to do is I want you to think about a time in the last couple of weeks where you were a follower. And this could be you were on a team you were a follower, on at a meeting, in a hospital administration setting, anywhere that you were a follower. I want you to reflect on what traits that you displayed as a follower and what quadrant you would put yourself in. And when you really dig down deep, you might find that you're sort of crossing two different ones. But I want you to commit to one and really reflect on what that says about you and what that makes you think about. So I'm going to give you guys 3 minutes of silence. And it'll be awkward silence, but that's fine, to really think through this. And then I'm going to ask at least one or two people to share their self-reflection. All right, 3 minutes starts now. Okay, so hopefully everyone had a moment or 3 moments to self-reflect and really think about where you are in your own followership style. And now I'm going to give you some tools to think about how we might both teach this and also become more effective followers. But the first thing we have to talk about are some barriers to followership. One of the biggest barriers out there is that followership is just happens, right? It's common sense. You are part of a team. If you're not the leader, you're a follower. And that can be pretty true. But remember back to those effective followership things. There's several traits in there that actually need active work to continue to improve on. So the assumption that followership is just something that happens then leaves a lot on the table. Another barrier to that is this hierarchy that we're talking about. When somebody has tenure or somebody has more experience than we do, there's an automatic assumption that because they're higher up in the hierarchy, we can't speak up, or they know more than we do. And that ends up really causing problems, as we saw in some of the RCAs, people unwilling to speak up. Another barrier to followership is poor communication. So not communicating clearly as a follower to your leader, and doing this hint and hope communication. So hint and hope communication is sort of this, if I say something to you, I'm going to hope that you pick up what I'm putting down. So that might be, hey, you're not getting that airway. How can I help you? Let me do these things. Instead of saying like, hey, this is not happening, somebody needs to step in. And so hinting and hoping is a barrier to followership because the team itself is not moving forward. Another really big barrier to followership is sort of this cultural and social upbringing that we have. And it ties directly to hierarchy. We're sort of taught that, you know, when you're at the bottom of the totem pole, I'm sorry, that's not a good example. When you're sort of at the bottom of the pile, then you know, as culturally, you're supposed to be seen and not heard. And so that kind of social upbringing goes into the workforce too, and can be a barrier to the effective followership. Not understanding the role of a follower and that it is specific traits, and not respecting the roles of followers, again, especially from a leadership standpoint, can absolutely be a barrier. And then one of the biggest barriers to followership is not having psychological safety. So if the environment itself is not a place where people feel that they can speak up and there's no psychological safety, then people aren't going to speak up. And that's a huge barrier to effective followership. Because if you remember, one of the biggest parts of effective followership is the ability to speak up. So let's look at an algorithm that gives some very specific skills for effective followership. And I'm going to go through a couple of examples, sort of one by one, so that we can sort of talk through what this might look like. And when I'm going through this, I want you to think about this both as a leader. So this is something you could teach to followers. Think about being explicit about these things. Here's a tool you can use. This then encourages people to speak up. As a follower, if you're having difficulty, if you're reaching for one of those barriers, this particular algorithm can help you get over those barriers. So at any point, you can follow any one of these algorithms. I typically say start with the 3 W's, move on to the 4-step tool, and then engage the team and use chain of command. However, if there are safety concerns, taking action and using chain of command or engaging team might need to happen sooner rather than later. So let's give a couple of examples. So you are a neonatal nurse practitioner, and there is a junior faculty that comes on, and you're presenting your plan. And so there's a 12-hour-old baby that started having tachypnea in the last couple of minutes. And you went in to examine the baby, and the baby was definitely tachypnic. The SATs were okay, maybe some retracting and nasal flaring. And so you review the chart and realize the baby was limited prenatal care and mom was ruptured for 18 hours. So you present your plan to the attending and say, I'd like to get a CBC, a blood culture, and start antibiotics on this baby. And the junior faculty says, no, I think that, you know, we need to be good antibiotic stewards. Let's just wait and see. You can get the CBC if you want to, but don't start antibiotics. And so this is a chance to potentially use the 3 W's. So what I see here is a 12-hour-old baby who was ruptured for more than 18 hours and had limited prenatal care. So we don't have a lot of prenatal testing. I'm concerned that this baby might be developing sepsis. And so what I would really like to do is go ahead and start those antibiotics rather than wait. I think that's very prudent. So you can see the 3 W's gives very clear, like what I see, what I'm concerned about, what I want. It avoids that hint and hope communication and really is very clear. The attending says, no, I've read some recent literature that says we give out way too many antibiotics. We do too many sepsis workups. I think that we just need to use the wait and watch approach. And so at this point, you could use the 4-step assertive tool. Get their attention. You don't have to be rude about it, but, you know, I would say, Dr. Haischer, I'm very uncomfortable with that. I think that we should potentially engage the team. So maybe we should talk to a few other attendings and see what other people think so that we can build consensus here. I would be uncomfortable not at least having a conversation with others. And so, you know, from that standpoint, if you're truly worried about danger, then you move up to engaging the team a little bit earlier. But again, you're doing it in a polite, respectful way. So we use the 3 W's. We did the 4-step assertive tool. We engage the team. And then if necessary, we can use the chain of command. So that's one example in the clinical setting. But what about in the non-clinical setting? So you are at a team meeting and your chair is you're talking about new candidates and you're hoping to recruit some diversity into your program. And your chair says, yeah, I'm not sure that we should include Xavier in this stack. I'm worried that with his thick accent, it'll be hard to communicate with families. So I don't think we should include him. And so at that point, this is when you would use your three W's. What I'm hearing you say is that we're excluding somebody because of their accent. I'm concerned about decreasing our pool of good candidates based on something like that. What I would really like to do is include him in our candidate pool. And if they push back and say, no, I don't think that's a good idea. I think their accent is going to make them a non-viable candidate. Then this is when you get attention and say, Dr. So-and-so, I'm uncomfortable with that. I think that we should at least offer to have Xavier interview with multiple members of our staff as a solution to this, and then give him a fair fighting chance before we move forward. So again, that offers a solution. It engages the team. And unfortunately, in this case, if it's your chair, then chain of command might be a little bit more challenging, but it is something that you could potentially utilize. So before I move on, are there any questions about the followership algorithm? Really a quiet bunch.
It doesn't look like there's anything in the chat.
Okay. All right. We'll keep on keeping on. So I've given you some traits of effective followership. I've explained how that could potentially help with burnout. And I've given you an algorithm that you could use that will help clear up the communication and give both trainees and faculty the words and the algorithm to use to help with effective followership. And so when we want to think about all of the strategies in the literature that talk about improving followership, a lot of what we've talked about today are things that they're already in the literature. So self-reflecting on your own followership style. I had you do that. I had you think through what are the things that will help you be the best follower you can be. The next step would be to get some feedback. So who could you potentially get feedback from? Who could you ask for feedback on your followership style and on your leadership style when comparing your leaders to your followers? One really great way to practice some of these things are using role play. And I know as soon as I say role play, people go like this. They're like, oh, role play. But it's really just low fidelity simulation. So that's what I called it when I was a program director. I'm like, we're just going to do some low fidelity simulation, role play. So having people role play different situations where they would be in a followership role and then giving them feedback on that. It really helps sort of bring the stress down and allows for those very specific traits to be able to be worked on. Another really great way to improve followership is to look for a role model. So me personally, I look to my fellows all the time. The fellows that work here at Walter Reed are incredible followers and display a lot of great leadership and followership skills. And so observe your trainees, observe people around you, and recognize what traits they are displaying as a follower and how you might be able to then utilize that. And really, we're thinking about building on followership as a leadership skill, recognizing that it encompasses underneath this whole idea of being a leader. So for the next couple of minutes, I want you to take this knowledge that we've done and do some self-reflection. Develop a plan for yourself on how you're going to apply leadership and followership in your practice. And I'm going to give you, again, another 3 minutes to really think about and commit. When you write it down, you're more likely to do it. So commit to this personal action plan. And then I will ask one or two of you to share. So in a personal action plan can be anything from some of the suggestions I gave to doing more self-reflection, anything that you sort of got out of this that will help you improve your leadership and your followership in real life practice. All right, so 3 minutes. Okay, I would love, I know it's asking a lot. People are very shy in this group, and that's fine. But I'd love for at least one person to come off mute and tell me what your personal action plan is. Any takers? Anyone? You can put it in the chat too if you'd like.
For me, I just graduated from fellowship, and I think one of my biggest struggles as a follower is having the courage to speak up, especially when the person I'm maybe challenging has direct authority or grading or judging of me. And I think moving into that junior faculty role, working on developing that courage and kind of getting rid of my imposter syndrome is something that I think I'm going to take away from this and really work on.
Excellent. And I thank you so much for having the courage to speak up. That's really great. I think you're exactly right. Like picking the courage to be a strong follower is incredibly difficult. And so recognizing how much it is part of a leadership skill. And when you're really thinking about it, the ultimate goal of the team is all the same. And so by having the courage to speak up and doing it in a way that doesn't like push someone else down, but helps lift up the entire team, just moves everyone forward. And it means that we're going to have more patient safety, and you're going to have more satisfaction in your job and less burnout. So I appreciate you sharing. I see someone else shared, so thank you. The implementing role plays for yourself and for your fellows to practice the skills and build language. That is absolutely perfect. That's a personal action plan. I want to get better and I want to build skills and language around what followership looks like. So let's do some role plays. And like I said, if you call them low fidelity simulation, you're more likely to get buy-in from your fellows. At least my fellows were like, I'd say role play, and they're like, oh, Dr. Haischer. So I really appreciate you sharing that. Anyone else would like to share their personal action plan? Got two really good ones. Well, if you keep typing, that's okay. I hope that you were able to spend some time thinking about this and reflecting. And I left the last couple of minutes to answer questions, which we already have one. So somebody put in a question, can followership styles change throughout a person's medical training or career? And is there a trend in a specific way with seniority? So that's a great question. Can followership styles change? Absolutely. Do they change? Not without intentionality. And so the type of follower that you are as a learner tends to be what you carry throughout your career, unless you're really intentional about building those skills. And it also depends a little bit on the environment that you're in. And so if it's a little bit easier to speak up, then it's easier to have to work on the courage to speak up. If you're in an environment where the minute you speak up, you get labeled, or if people, it's a toxic environment, people won't listen, that makes it much more challenging. Not impossible, but challenging. So yes, followership styles can change with intentionality, which is part of the reason I created this workshop, was to get people to start thinking about that. As far as being a trend with seniority, that doesn't tend to happen. Although people in senior roles tend to be followers less because there's less opportunities when you're in a leadership role. But the really important point I want you to take away from this is that as a leader, if you don't recognize good followership and followership skills, you're going to end up having a mismatch with the followership styles. And that is one of the things that contributes to burnout. All right. I feel like imposter syndrome follows us always throughout our career, no matter what level we're at. But if we focus on best actions needed to provide best patient care and safety, we cannot doubt ourselves, and we should always act in the best interest of our patients, and we can't go wrong. So yes, have the courage to speak up for patients, 100%. And I heard something the other day that like totally changed how I felt about imposter syndrome. And maybe this will blow your minds too. So you can't learn and grow if you don't ever feel like an imposter. So imposter syndrome is just really telling you that you are stretching yourself and learning and growing in a new way. And it really just like made me stop and say like, yeah, if you are always like super confident with what you're doing and you never feel like you're a little bit of an imposter, it means you're not stretching yourself and you're not pushing yourself and learning and growing. So harness that. The next time you feel like an imposter, you can tell yourself, I'm learning, I'm growing. Now I need to have the courage to speak up for patient safety. So I really appreciate that comment, and I appreciate that question. Are there other questions I can answer for you all about burnout, about followership, leadership, how they all relate to each other?
Dr. Haischer, we have another question.
Oh, yes.
How can leaders facilitate the professional development of trainees and other followers in their units that have opposite followership styles as themselves?
Ooh, that's a really good question. So a big part of it comes at having your learners start with self-reflection, and doing some self-reflection yourself. So recognizing what is your leadership style or what is your followership style, and having people recognize what theirs are. So basically just kind of like what I did, show what the different traits are and show the little model. And that will help that gain insight. So that's a great place to start, is sort of gaining insight. And then recognizing that just like in leadership, followership has skills. So rather than say, hey, let's work on your followership, and it doesn't matter like what quadrant you're in, but let's think about what are the skills you need to be an effective follower, and then really working on those individual skills. So is it having the courage to speak up? Is it giving people the language, the 3 Ws? Is it giving people the opportunity to work on proposing solutions? Is it helping people be empowered for critical thinking? So thinking through each one of those different traits and really thinking about how you can help people with individual traits rather than their whole followership. Where it does become really challenging is when you have very authoritarian leaders who tend to very grasp onto hierarchy and they don't buy into this idea of followership. That can be more challenging. But that, again, takes some self-reflection for the leader to recognize if you bring it all back to patient safety, yes, there's a hierarchy, but at the end of the day, patient safety is the most important thing. And so helping gain some insight into there. And then also bringing up that idea of burnout, that we're burning people out by not matching or at least helping people gain those followership skills. So it's a great question. Any other questions I can answer? Well, here is my email address. So feel free to reach out to me anytime. Faculty development is my full-time job. At this point, I do a little bit of clinical medicine still to keep my skills sharp, but most of the time I'm teaching. And I love talking about faculty development, and I love answering questions and consulting with people. So feel free to reach out to me. I would also really love your feedback. So feel free, please use this QR code and give all the feedback. I will take it and I will continue to make this better. But I mostly just want to thank you for inviting me to come back to the community that I've loved so much and have an opportunity to share with all of you. So thank you all so much.
Thank you so much, Dr. Haischer. If you do not have an ability to scan the QR code, the link is posted in the chat box.
And thank you to my awesome moderator for being awesome.
Okay.